Hi, I'm Elizabeth Randall, and this is the axial skeleton video for Bio 235 Fall 2014 at APU. So we're going to start with the cranial bones. So the first cranial bone we'll be discussing is the frontal bone, which makes up part of the forehead and a little bit of the orbit of the eyes. The next bone that we will be identifying is the parietal bone, which, if you look at the skeleton, are this bone right here, and you can see the suture that separates the frontal from the parietal. The next bone we're discussing is posterior view, and you can see the sutures that now separate the occipital bone from the parietal bone. And this little lump right here, that's this little knot on the back of the head, is the external occipital protuberance, and what this does and what this functions as is a point of muscle attachment from the skull to the vertebra to allow us to hold our head upright. So now we're moving on to the temporal region. So the first piece to identify is the temporomandibular joint, which is this little joint right here. It allows our mouth to open and close. This is not working very well, but that's okay. The next identifiable is the mastoid process, which is back here, adjacent to the temporal region. Then we move to the styloid process, the external acoustic meatus, which is right here, that's that little notch here. And then we move on to the the squamous area of the temporal, which is right here. It's the flattened region. So now we're looking at an internal view, and the petrous part of the temporal bone is right here. And what's housed in that structure are the middle and internal ear cavities. If you turn our friend here around, this little groove right here on the back of that is the internal acoustic meatus, and what passes through that opening are cranial nerves 7 and 8. So moving on, we're going to discuss the sphenoid, and we are going to identify the superior orbital fissure, which is inside, and it's a fissure that runs up and down. On the diagram, because the skeleton is so small, that is right here. That's your superior orbital fissure in our book. That is page 203. And what runs through there are cranial nerves 3, 4, and 6, so a really easy mnemonic to remember the nerves that run through that structure are live frankly to see absolutely no insult, or live frankly to see absolutely no insult. So it's the lacrimal nerve, the frontal nerve, the trochlear nerve, the superior division of the oculomotor nerve, the nasociliary nerve, the inferior division of the oculomotor nerve, and the abductans nerve. There we go. So moving on to the interior structure of the sphenoid, and I have my lovely lab assistant, my husband Dustin, helping me hold this. We are looking for the lesser wing, which is, this is the front of the skeleton. The lesser wing is right here, and the greater wing. And then moving on, we're looking for the optic canal, which is right here. And that does house or allows passage of the optic nerves and the ophthalmic arteries. And then the sella tertia, which is right about here, and that houses and the pituitary gland sits on that structure. Moving on, we're looking at the ethmoid, an internal view, and so this is the crista galli, and it attaches the dura mater anteriorly to the skull. Then we also have below it the crib-form plate, and what passes through those holes are the filaments of the olfactory nerves and cranial nerve 1. We're now moving on to the sutures. So the first suture is the coronal suture, which is right here, and that attaches the frontal bone to the parietal bones. The second is the sagittal suture, and that runs down the length of the skull, connecting the two parietal bones. This is the coronal suture, which connects the occipital bone to both parietal bones. And then if you look to the side, you have the squamous suture, which connects the parietal bones to the temporal bone. So moving on, we're going to discuss facial bones. So this is the maxilla and alveolar process, which include the teeth. Then the nasal bone, which is right here, sharp protuberance. And then we have the zygomatic, which is right here. That's your zygomatic bone. And the two bones that form the zygomatic arch are the temporal bone and the zygomatic bone. We now will turn right back to the ethmoid bone, which is actually a better view of that is in here. That's the ethmoid bone. The vomer, which is actually, again, better view, is right here. It's the upper portion of this back in here. And the two bones that form the bony nasal septum are the vomer and the perpendicular plate of the ethmoid. The inferior nasal concha is at the base of that, and what that bone does is creates air turbulence. So now we're moving on to the mandible, which is your jaw. So this is the mandible body. This is the mandibular angle right here, where your jaw curves. This is the mandibular ramus, which is this hole right here, this arch. The mandibular condyle is here. And the mandibular notch, very, very difficult to see on this particular skeleton. It's right here. There's a little dot. And then the coronoid process is right here. This other little notch right here. So moving on to the vertebral column, there are 4 curvatures of the column. The first is the cervical curvature, and that's the first 7 vertebrae. It is concave, that's C1 through C7. The second is the thoracic, which obviously is part of the thoracic region, and that is T1 through T12, and it's a convex. So where you have concave, now you have convex. And the third is the lumbar curvature, which is the small of your back, and that has 5 vertebrae, and that's L1 through L5. And then the last curvature, number 4, is the sacral curvature. It's convex. It has 5 fused vertebrae that make up the sacrum and 4 fused vertebrae that make up the coccyx, which is your tailbone. There are 2 secondary and 2 primary. Primary meaning they were formed in utero. So that would be your thoracic and your sacral curvatures, and then the 2 that are secondary that appear and form a few months after birth are your cervical and your lumbar curvatures. Okay, so the cervical vertebra, there's 7, and those are your first 7. This is the atlas right here. This bone articulates with the occipital condyles, and it allows you to do this. Shake your head yes, and that's why it is important. So what is unique about the transverse process of all the cervical vertebrae compared to those of your thoracic and your lumbar? They actually have holes in them that allow, which are called transverse foramina, and they allow the arteries to pass up through the spinal cord to supply the brain with blood. Okay, moving on to the thoracic vertebra. There are 12, and they form the back part of the posterior part of the rib cage. And these are the spinous, I hope I'm not pronouncing those, the spinaus process. Right here, these little appendages to the side are the transverse processes. And the invertebral foramen, which what passes through these is the spinal nerves issuing from the spinal cord.